Hey, everybody, and welcome to the Wellness Blueprint Podcast. I am Dr. Caleb Davis, and I'm joined by fan favorite co host Nicole Davis.
Hey, everybody. Welcome back.
It's been a while, hasn't it?
Yeah, well, we had a good reason for being away.
So it has been 5 months since we recorded our last show.
Probably. Yeah, well,
It's
at least.
hard to believe. We had some big life events happen, all good ones, nothing terrible. But I had intended to take 2 to 3 months off the show. Instead, that turned into 5.
hmm
Nicole, do you want to make any announcements?
Yeah, sure. We have a baby girl now.
We have a 5-month-old daughter now. That was one of our big reasons, but alongside that, we also moved to a new city. I left my private practice and joined a hospital group. So I have a new job, new city, new house, big move, new daughter. So with all these big adjustments, we had to take a little time off, but we are back.
We are back and ready to go.
I think we should reintroduce ourselves just because it has been so long. My name is Dr. Caleb Davis. I'm a board certified orthopedic surgeon. I specialize in shoulder and elbow surgery. However, I have a great passion for health and wellness and injury prevention, and which is a big theme of the show. And Nicole is the heart and soul and fan favorite of the show, and with whom we could not do this show.
Yeah, pretty much. I don't know anything about medical stuff except what I've picked up over the last, 15 or so years.
Yeah, you've been through it with me the whole way, so I think you have an honorary doctorate.
That would be very scary for any patients who might come across me. I'm a pretty good armchair psychologist. I'll give you that.
Oh, I think you're very good with the mental health stuff. Some topics that we've covered in the past, in past episodes, in terms of mental health and how exercise and physical health are linked to mental health as well. But because we are new parents, I thought that it would be good to get back after our long hiatus and do an episode about health effects of being new parents.
Yeah, because who knew? Having a baby's hard.
you know, I had a vague idea, but until you get to experience it yourself, it's just not quite the same thing as knowing it in theory, is it?
No, yeah. Yeah.
I have a whole outline of topics to discuss, but Nicole, what do you think is one of the biggest things that's been tough for you to face as a new parent in terms of your physical health and how it's affected you?
I would say the hardest thing, especially in the first month or so, 6 weeks, was the lack of sleep. Because I know personally with lack of sleep or inconsistent sleep, that affects my mental health and it affects so much in terms of energy levels and everything else.
Yeah, and I don't think that you're unique in that at all. I think that's probably one of the number one complaints, especially in the first 6 weeks, like you said. And normal, consistent sleep for a newborn can vary pretty widely. So when you start getting full night's sleep is very different from child to child. So that's probably one of the number one complaints that we see. And this has been well studied, especially in the first year, really. Most parents have much less sleep, it's much less quality sleep. And if you've listened to our past episodes about sleep, you know how important that is. There's also things like increased blood pressure, increased cortisol, increased stress in general involving it with a new parent. So that's another thing that's often cited as a big problem. Now, our situation is a little bit different since we did adopt our daughter. Nicole did not go through a pregnancy, so we're not going through any of the postpartum physical changes, but increased blood pressure for a new mother after giving birth is a big concern. In fact, we actually knew someone who had a stroke after her pregnancy.
Yeah. And I've
Uh,
known several women who have been preeclamptic.
Yeah, preeclampsia is definitely a very common thing and is closely monitored during the pregnancy, but some people can even have prolonged high blood pressure issues afterwards. I've also heard of concerns of developing sleep apnea, which we also have done an episode on, where you're not getting enough oxygen, so your quality of sleep is bad, and it actually can increase your risk of heart attack and strokes as well. So all of these things are seen in postpartum mothers and new parents alike. And how do you feel, Nicole? You're the mental health expert. How does mental health tie into this?
Oh man, there's so much that can go into this. If you are experiencing lack of sleep, which I'd say a lot of new parents are, then you've got the inability to fight things like anxiety and depression. You probably don't have the energy to even go out and do things, so your social circle gets smaller. You don't really have the energy to work out, and so that can affect your mental health as well. But then you've got to deal with stuff like imposter syndrome. I know a fair amount of parents and mothers, they worry that, oh, what if I'm not a good enough parent? And they fear this. They have anxiety regarding their child's health. I know parents whose children have been in the NICU, especially. That's the neonatal intensive care unit, right? Especially if your kid's been in the NICU, you're constantly on guard. You want to make sure that whatever issue is plaguing your child is no longer an issue for them. I know for us, when our daughter went through that, as soon as she got out of the care of the NICU with all those wonderful nurses who were watching over her 24/7, and suddenly she was in my arms, and I was like, "Uh-oh." Like, "Well, I'm not equipped for this. I don't know about this."
Yeah, I think a lot of parents feel that imposter syndrome, like you can't possibly be ready when their life is completely in your hands. But you mentioned isolation and not having enough community. That's really important. That was a topic I want to touch on. One of the most important things to do as a new parent is to make sure you don't isolate yourself. And it's very easy to do. It's hard to take your child out of the house. It's hard to get ready and do anything. I remember one of the first times we took our daughter out of the house, it felt like a chore just to take her 5 minutes down the road just because she was screaming and trying to get her in the car seat. So it's really easy to just lock yourself away in the house and never leave. But I have found personally, and there's studies to back this up, the more you can surround yourself with other people and have a support system, the better you'll feel, the better your mental health will be. And actually, there's biomarkers, things like decreased blood pressure, better quality sleep that coincide with having more community and exposure and support system. Now, that's easier said than done. Sometimes you just don't have that support system. But it's important to think about because if you do have access to friends, family, maybe a some sort of community center, maybe it's a religious foundation, make sure you access that and use that as a support system because it's really easy to lock yourself away.
Well, and sometimes you move away from your support system. Now you have to start over.
That's right. That's right. And that's even more difficult. New parent, new home, new community. It can definitely be tricky. We've talked about sleep, we've talked about stress, we've talked about community. What are some strategies, Nicole, that you've used to try to help with your sleep and your stress levels as a new mother? I'll tell you that there are some strategies for new mothers, and a lot of it has to do with trying to get dedicated sleep. Now, for these strategies, you basically have to have a spouse because that baby is not going to adhere to any sleep schedule that you want to put in place. Although it is possible to start sleep training as early as 5 to 6 weeks old. Although there's some debate on that and exactly how well you can have a newborn consistently go to bed at the same time. More often than not, you are waking up every 2 hours to feed a baby in the first couple months of life. However, if you have a spouse who can help share the load, it is important to try to get at least 2 days a week where one spouse takes the entirety of the feedings at night and lets the other spouse sleep. And this goes back and forth between mom and dad. It's important to try to at least get 2 days a week where you can get uninterrupted sleep if possible. That's easier said than done as well, especially if you've got two working parents and someone's working third shift, or maybe you don't have a spouse to help share that load either.
Or maybe your husband's a surgeon, he's pretty busy, and he's got to operate on people the next day. And you're like, oh man, I kind of want him to be in tip top shape. So maybe I'll just be a little more sleep deprived.
That's right. Yeah. So there's definitely situations where it can be hard to share that load.
But I also know parents, this is obviously more likely more affluent parents. If they're both working, then they might hire a night nurse, somebody to come in and actually feed the child during the evening. I think back to those days of the ancient times with our ancestors where they had the milkmaid. What was she? The nursemaid?
The wet
The
nurse,
what nurse?
the milkmaid. This is why
Uh,
Nicole's a fan favorite, by the way.
yeah.
I believe a milkmaid is someone who milks.
Oh, right.
A,
Yeah,
a,
no, you're right.
a
I
wet
did
nurse
not
is
grow up on a farm,
a
so I
wet
don't
nurse
know.
is someone who is brought in who's lactating who can breastfeed a child.
Yeah.
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 I'll be honest, I don't know anyone who has had a nurse who has come in and fed their baby at night for them or a
I know
wet nurse.
somebody who recommended it to me. I
Maybe,
won't tell you who
maybe,
it was.
maybe I'm not yet in that affluent stratosphere. I'm not familiar with that. We'll leave that one alone. The other thing that I've seen happen with new parents is that moment the child finally goes to sleep, they decide they stay up because they've had no time to themselves. And it's the stolen time fallacy, as I think is what they call it, where you now stay up much later than you should because you're trying to get that time back that was quote unquote robbed from you. So it's important to still maintain that sleep discipline. And you can employ some strategies we talked about in past episodes, like blue light blocking glasses or meditation, deep breathing exercises, trying to avoid blue light and screen time, or cutting off caffeine more than 6 hours before bed. All of these things are good strategies to try to help if you're having a hard time going to sleep when just because you're on overdrive, you're stressed out and frazzled. And once your baby's finally asleep, it's hard for you to go to sleep sometimes.
Yeah, well, I will say that for me personally, a couple of things that I did when our daughter was very, very young, and I would have to feed her every 2 hours, and it was hard for me to stay awake. I would often just have the TV on And that way I could watch something during those moments
Mhm.
and try and trick myself to stay awake.
Yeah, now
And
that's a different problem, right? Where I was talking about trying to get to sleep when you're
yeah.
all amped up, but you're trying to stay awake during the feeding.
Yeah, well, because
Yeah.
I don't wanna accidentally fall asleep with her in my arms or anything like that,
Mhm.
and that was a real issue, like, I have a hard time staying awake. So, that was something that I would have to do. These days, I rely more on audiobooks to kinda keep my brain engaged, and that way, my daughter's a little more mobile, so I can get around the house, especially if I'm carrying her. I have a lot of different baby-wearing contraptions. So audiobooks are a big plus for me. And I would definitely take people up. Our both of our mothers were incredibly helpful in terms of coming over and taking the baby, letting me get a nap, whatever. So we just have a huge support system, especially in those really early months that I just cherished. We have some very good friends who would come over and or they would bring food. Our church community brought us food after we came home with the baby. So we did have a lot of support in that way.
And there's no denying we are very, very blessed by the amount of support that we've had. We had a great support system, and there's just no getting around that. And unfortunately, a lot of people just don't have that, so they have to rely on what they have.
Yeah,
Um,
also, I'll say when we were exhausted and didn't feel like going anywhere, and it was really challenging to wrangle an infant into a car seat anyway because she hates it.
yeah, some babies love the car seat, drive around at night to get them to go to sleep. Our baby does not.
She's like the opposite.
No, she hates it.
Yeah, but she sleeps really well.
She
So,
sleeps really well now.
yeah,
After she was 2 months old, she started sleeping through the night, which again,
it's like a unicorn. I think we have a unicorn as a
not all
child.
babies do that.
Yeah,
Not all babies do that.
yeah.
Again, we are very blessed, and I think probably some people might hate us for it.
Well, the other thing is I made the personal decision to focus on our daughter, and so I'm not really working anymore. And that's also I guess I don't know if it's a controversial topic, but back when I was a kid, it was quite normal for mothers to be stay-at-home moms. And I think there's been a resurgence in women my age to kind of be interested in that, and a lot of people are unable to make that decision no matter how much they'd want to. And
Sure.
so something that I've learned is that this is the new affluent lifestyle in a lot of ways. If you want to be a stay-at-home mom, that means most likely your spouse or your significant other makes enough money to support the entire family unit.
Right. We're really getting into real and relevant socioeconomic issues, all important topics, but I'd like to get back to the health aspects of it.
That's
Uh,
fine. Well, I was just gonna say that's how I've been able to deal with the sleepless nights because I don't have to go into a job
yeah,
because can take a nap during the day if my daughter's napping, and that's
right.
super helpful.
I think probably what we've succeeded in doing is just making everyone hate us. Let's talk about some other strategies, though, just for that anyone might be able to apply. When it comes to mental health, we have talked about blood pressure, we've talked about sleep. Postpartum depression is a big, big thing, and it seems to be on the rise. And I think people have a little bit more education on this now, but having people to talk to, again, we go back to that community, knowing the signs of postpartum depression and recognizing that it's nothing to be ashamed of and you can speak to your doctor about it are all very important things. And I think awareness has helped with this condition. But I think poor sleep, poor nutrition, and low activity and low community, all of these things contribute and exacerbate what is a very serious medical problem. Something that I really thought would be helpful to talk about are different routines and decision making you can do to help lower the risk of that. Some of it's medical. Some of it you may talk to a physician about medication. However, exercise is one of the first things that go as a new parent, and I can attest to that. As someone who's very active and loves to exercise, it really went by the wayside in a pretty significant way. So even just getting outside, getting your baby in a stroller, getting and going out on a walk is incredibly important. It helps lower your blood pressure, helps control your blood sugar, decreasing the risk of developing diabetes, which can be a big problem for new moms as well. And also, it can be an exercise of mindfulness when you're out of the house, not staring at a TV, not staring at your phone, and just reflecting on the day and the past days, and maybe taking time with your spouse as well to speak to them and communicate and meet each other's needs. So you're really hitting three things all together.
Or finding other social community, like walking with other people in your neighborhood.
It's a great point. I'm glad you brought that up. Just because you don't have someone in the home living with you to help you, it's really important to find that community. So if you're in a neighborhood or meet a group of moms that you can reach out to have that community and go on these walks with, incredibly important for so many different reasons.
Yeah, I know many women who have dealt with postpartum depression on varying levels of severity. And I think for a lot of them, the severity, I don't want to say it snuck up on them, but I think that it took them and their partners by surprise, just how bad and severe that it got. And eventually they needed to do some interventions, like medical interventions, which I do want to encourage women that talk to your doctor about this, but I believe there are a lot of antidepressants that are safe for nursing mothers. So that is something that you can talk to your physician. You don't have to feel like there's a stigma with that or a concern for your baby. And let's see, depression can get really serious rather quickly. So it's definitely something to worry about.
Let's say have it on your radar. Definitely have it on your radar and be looking for signs of you can't find any pleasure in life, you don't want to move, you don't want to get out of bed. More seriously, suicidality thoughts, or even sometimes thoughts of wanting to harm your child, as horrible as that may sound, and hard to conceive that may happen.
Or even thinking that you're not the best person to care for your child. If you're constantly plagued by things like that.
Which is actually a pretty common thought, I think, for a lot of new parents, whether they have postpartum depression or not.
Yeah, but I think it's more of like this continuous cycle of thoughts
Right. More of
in
an
your mind.
intrusive
Yeah,
thought that doesn't go away.
right. And
Sure.
it's just and it's very challenging for people to get rid of that thought, even if they try. And then it's, the more depressed you are, the more these thoughts can come in and kind of batter your brain until eventually you're believing it, and your thoughts will help shape your body. And so that gets very tricky.
Yeah, I think that's a great point, and I'm very thankful that more and more people are becoming aware of it as a problem and that it's treatable. And I think there are, institutionally speaking, from a physician standpoint, I think there's more and more screening for it as well in terms of checkup appointments, physicians screening the mothers for this to try to be on the lookout, which is good.
Certainly. Yeah, I've noticed that at my pediatrician appointments for our daughter. And also my general practitioner appointments. They'll screen me for stuff, and I'm like, "Oh, are you supposed to screen me? Because I didn't biologically have this child." But at the same time, given my past history, like I'm glad they're screening me.
Yeah, just much more stress, sleep deprivation, all these things.
Yeah.
Yeah. I think in the past we've talked about decision fatigue, the concept of you have the strongest willpower in the morning, and then as the day goes on, it's easier and easier to make bad decisions. So sometimes what people recommend for new parents is that they try to make some of those hard decisions in the morning. Maybe they do a meal prep early in the morning or on weekends where they don't have as much stress on their plate, so they're making good food decisions, so they're not eating highly processed foods. All this goes hand in hand, by the way. When you're stressed out, you don't sleep. This leads to bad decisions. It leads to lower satiety, meaning you want to eat more processed, sugary junk food that is high in calories, which then leads to insulin resistance, diabetes, high blood pressure, and it's a vicious cycle.
Yeah.
So, a lot of times, if you can make good decisions first thing in the morning, like going on a walk, getting some exercise, doing the meal prepping, that all of these things can really add up. And then a lot of times you're on a roll and you feel motivated to keep doing those good decisions. So, that's another piece of advice I'd have for a lot of new parents.
Or doing what I like to call for myself, setting myself up for success. So even the night before, if I know that I have a plan to go leave the house and bring my daughter with me, I make sure her diaper bag is ready to go. And that way it's all there. I don't have to worry about, oh, did I have enough diapers? Do I have an extra change of clothes? Do I need how many bottles do I need? Do I have enough formula packed? That kind of thing.
That's a great point. When you have the wherewithal to do it, then, because if you're doing it when she's pooped all over herself and she's screaming, and you're like, "Oh, I just don't want to go anymore," that you're gonna not go. You know?
That's the thing I found most surprising as a new parent, Caleb, is how often babies poop. I
Yeah.
was not expecting that. That's so much poop.
I will say that I think Nicole has the harder job here. I work, I'm out of the house a lot. So she definitely has the brunt of the parenting here. But I will say that in my medical training, I was very well prepared for the amount of bodily fluids that come out of all sorts of humans, of all shapes and sizes and ages. And I was also very used to sleep deprivation as well, thanks to residency. And I also had six brothers and sisters, and I had lots of younger siblings. So I've been around babies my whole life. So it was definitely an adjustment still. For me, it was definitely the just to have no energy or inclination to exercise at all. It was the
Mhm.
biggest thing. You have this crying baby and you're just trying to hold as still as possible so you don't wake her up. And then that you just become so sedentary. At least that was my experience. And I'm just now recovering.
Yeah.
I do want to touch on sleep apnea real quick, just because it is something that it can happen to mom or dad, really. Now, obviously, generally, the mother will be gaining more weight with pregnancy. And so some of the things you're noticing are lots of snoring. You're waking up feeling that like you have not been replenished or refreshed from your sleep. And your spouse may be, if you have someone who sleeps with you in your room, may notice that you have stopping breathing during the sleeping or making very loud snoring noises as well.
Pro tip, if they don't believe you, just record them.
That's a true life story. Go back and listen to our CPAP, sleep apnea episode if you want a whole lot more details on this. But that's definitely something that both parents should be aware of. Now, having listened to us talk for about 30 minutes about all of these different challenges with being a parent, I do want to switch gears just a little bit. There's a lot of great things to be being a parent. There's actually a lot of studies that have shown that parents actually may have increased lifespans compared to those who never have children. This is seen more in men than women. There's some studies that have shown that maybe women maybe lose a year of their life. There's some studies that show that maybe women gain a year or two of life when being mothers, but across the board, fathers actually gain lifespan and longevity because they're parents. And a lot of people have posited that is because they have more meaning in their life. And there's a lot of people who believe if you have no meaning, you don't feel fulfilled, you have no happiness. And that really goes a long way to depression, anxiety, and as we know, all of these things contribute to your physical health. So there's no really definitive study that says if you have a child, you will live longer, but there's a lot of different factors that point to that direction.
Hmm.
And I can tell you personally that being a father is one of the best things that's ever happened to me. It's so fulfilling to be able to take care of a child and watch them grow and learn and love. And it's one of the best things I've ever done.
I say it fills our lives with a lot of joy. Just seeing her, especially as she progresses through her milestones. I don't know. I love waking up and every day and thinking, man, what's the next thing our baby's going to learn? What's she going to do? Right now, she's on this really adorable, high pitched yelling streak, where
Yeah, that one's fun.
yeah, where she's just hanging out. Like she was cooing. She would coo a lot when she was in her crib, or if we just had her hanging out with us when she was doing some floor time. And now it's just flat out yelling. And I get alarmed at first. I'm like, oh, what's wrong? What's wrong? And then I'm looking and I'm like, oh, she's fine. She's all right. She's just like wanting to test out the boundaries of her voice, I think.
Nicole, were there any other topics you wanted to cover on the podcast today?
Oh man, I'm sure there's all sorts of stuff we could talk about. And I'm sure there are a lot of challenges of being a parent that we have not experienced because we have a unicorn baby. I'll just say this, it's one of the most difficult things you can do in life, but also one of the most rewarding. And all worthy things are difficult, though. That is something that we've just learned in life in general, like you going through residency and becoming a surgeon. And our marriage, it's wonderful. It can be difficult at times, but it's fantastic. It's the best thing. Our relationships with people. And so, when it comes to raising children, you're going to find a high reward and high difficulty level on that scale.
Yeah, I think the best things in life do have to be earned, and you have to suffer for them a little bit. I agree with that. Just to get a little philosophical, the takeaway, the summary I would do for this is there are real health concerns that new parents have to be on the lookout for, but there are ways to mitigate them as well. And you'll probably have some ups and downs as your child goes through different phases. But as long as you know what to look for and know how to try to mitigate those problems as much as you can, I think that you can be very healthy, successful, and happy even during the early stages of your parenting. And knowing that those things are also reversible if you are developing any of those problems. And things will get better and you will continue to learn and you will reach equilibrium and you'll be able to still have a healthy lifestyle even with multiple children if you so choose to.
I was going to say, as a new parent, it's important to give yourself grace just to know that you're not going to be able to achieve or do all the things that you were able to do before the baby came. And you're going to have to be okay with letting some things go and prioritizing things and dropping the ball on things that aren't quite as important as they used to be. And so for you, while exercise is incredibly important, and it is for everyone, you had to drop the ball on that for a little while because it was more important to you to make sure our daughter was fine and that I was fine and that you could balance work and family. And then as soon as we started to get a handle on both of those things, that's when you said, okay, I really need to get back into a healthy lifestyle. And you've started adding that back into your priority scale. So that's something that I would definitely recommend for new parents as well.
I think that's a great way to wrap up the episode with that closing message of you will have struggles, they will affect your health, you will be stressed, you will lose sleep, but there are ways to fix these problems, and you will reach equilibrium. You will find a routine that works for you and your family, and you will be able to still be healthy and have a life. And you'll learn what's most important and what to prioritize, and that's what you choose to make of it. I promise this is not going to become a parenting podcast. I
Mhm.
just thought this episode would be fun to talk about some of the health things that go along with being new parents, since this is our first episode back after 5 months of being away and us being new parents. So, thank you so much for coming back and listening to the show again after our long, long hiatus. And I hope to see you again soon with the next topic. I would love to hear any comments on the social media. You can go to Instagram at Wellness Blueprint Podcast. You can leave comments there, make suggestions, or send us messages on topics you may like to hear. And we'd love to hear it. Nicole, thanks for doing the show with me.
Yeah, of course. Until next time.
All right. It was great to be back. We'll see you all next time. Hey, listeners. If you're enjoying the podcast, don't forget to like, subscribe, and leave a review on whatever platform you're tuning in from. Your support helps us reach more people and bring you even more great content. Also, be sure to follow me on Instagram and TikTok at Wellness Blueprint Podcast. We're also on Facebook as The Wellness Blueprint with Dr. Caleb Davis. We also have our website, drcalebdavis.com, for updates, behind the scenes content, and more. Thanks for listening.